Hey guys, do you work in emergency medicine? An absolutely crazy and intense environment where you see things every single day that most people don't see their entire lifetimes? You feel burned out, unappreciated, like there's nobody you can talk to about the struggles and the things that you see every day? If that's you, I want to let you know that you are not alone. Today I have a bunch of real professionals with real careers in emergency medicine that can relate to the struggles you have on a daily basis. My mission with this new format is to share stories that educate, encourage, uplift, and maybe just that you can relate to that aren't that uplifting. I mean, a lot of our stories in emergency medicine are not uplifting stories, right? But I want you to know you're not alone, and I want you to not just survive working in emergency medicine, but thrive in emergency medicine. Maybe you're a brand new EMT, paramedic, nurse, and you got criticized by a physician today, and that made you super frustrated your whole shift. You're driving home, that's all you can think about. Maybe you missed a lot of IVs today or had a super challenging patient you had to deal with. If so, this show is for you. My guests are from every walk of emergency medicine, and they're here not because they have it all figured out and they're perfect at this job. It's because they actually have a desire to help you. By the end of this episode, I hope you feel encouraged and feel like you're not alone and realize that you can succeed in emergency medicine regardless of what level of care you provide. You can leave your shift without feeling beaten down, burned out, and discouraged every single day. I personally have struggled with burnout, discouragement, frustration many times throughout my 15 years in emergency medicine. My name is Aaron. I'm the host of Practical EMS. I've been an EMT, paramedic, and now ERPA. If that sounds at all of interest to you guys, please stay tuned. I'm going to bring in my guests and we are going to have an awesome show. So first what I want to do is just introduce all the guests that are here, their backgrounds. We can just use first names, your credentials, your length of time in emergency medicine, how you ended up, and maybe like how you got inspired to start in emergency medicine. So we can start over here since we have the awkward microphone situation. Just make sure you guys are talking right into the mic.
Get that beard on that camera.
So name, credentials, length of time in emergency medicine, how you ended up in emergency medicine.
Okay, I'm Casey. I started in 1976, so you can do the math.
You're 23 with some experience.
Anyway, I'm a paramedic. Actually, I have critical care experience as well with flight crews and so on. I work on the ambulance still, but that may change. But anyway.
How long have you been in emergency medicine again? So
47 years.
47 years. Okay.
Yeah.
Awesome.
I'm old.
How'd you end up in emergency medicine?
Well, I think we've talked about this, you and I. Actually, had an ambulance company down there that they used to run out of their homes. And so one of the ambulance crews were a set of brothers that lived down the street from me. And I remember when I was 5 years old looking out my front window and watching those guys, run code 3 down the street. And I thought, man, that looks cool. There's something, I don't know. I got something weird. It's something about rotating beacons or something. It just attracted me to it. And so when I got older and got into high school, my girlfriend's dad actually owned one of the ambulance companies. And so it was a natural progression for me to go to work for him. But anyway, so I worked with them and then everything just exploded out of that. My one of the guys that was the director of the emergency department in the town, he asked another EMT and myself, the other EMT worked for the other ambulance company, but we'd gone to school together forever.
Yeah.
Grew up together and we're friends. But he asked us if we would be willing to go paramedic school and he would pay for it. And so we were like, twist
easy.
my arm. And there weren't very many people there, paramedics. In fact, there were no people there, paramedics. And so Alan Middlecamp and I became the first 2 paramedics in that city.
Yeah,
Nice.
Cool.
Awesome.
Okay.
Yeah.
All right. Why don't you swivel the mic to Kierra here and she can answer the same question. So first name, credentials, length of time in emergency medicine. How'd you get into emergency medicine?
All right. Yep. My name's Kierra. I am a registered nurse. I've been in the emergency department my entire career, which is almost 7 years now.
That's right. I forgot you're like 20.
Yes, that's accurate. Thank you. Yes. Thank goodness. Throughout that time, I've been a bedside nurse, a charge nurse, trauma trainer. I love it. I got into the medical field kind of by chance, honestly. I was coming up on my senior year of high school and I played soccer, so I was going to get a soccer scholarship, but
Say it with your chest.
Oh,
Come on.
but I wanted to also, go to college to get a degree, but I wasn't sure what that was going to be. And there was a program that if you got in, you could shadow different areas in the hospital. And my dad was the one who found that, actually. So I applied and I got in, and I got to do some rotations in the hospital, and only a very brief part of that was in the ER, and I loved it. Right
Did you
away.
say that was in high school?
Mm-hmm,
What's the name of that program?
Learning Link?
I did that when I was in
You
high
did?
school. Yeah.
Oh my gosh, yeah. So
Yeah.
it was amazing. It's since gone. That program is gone, but I loved it. So I declared nursing and never looked back.
Very cool. Yeah, I forgot. I actually did Learning Link in high
That is
school.
so cool.
There was it was like a green polo shirt and
Uh-huh.
white scrub pants.
Very
That you
ugly.
could see your
Yes.
underwear through
Oh,
the
yeah.
white
It's
scrubs. That's why
horrible.
people
It's
don't
horrible.
really wear white
That's
scrubs.
what you remember?
It's horrible.
I remember shadowing in the PACU, and I was like,
Oh.
I don't think I could do
No.
this.
No.
But the ER was the place everybody wanted to be, but there was no rotations in the ER, so I didn't get to do it. That's funny though.
That is really cool.
Hopefully you guys know me. My name's Aaron. I have been a ERPA for the last almost 4 years, and I was an EMT, and I'm still a registered paramedic. I started that back in 2008, so I say about 15 years in emergency medicine now. I kind of ended up in medicine randomly too. I knew I wanted to do something in medicine, had no idea what, and just on a whim, somebody told me to get my EMT. Didn't have a clue what that was. And so I got my EMT, and I've just kind of been in love with emergency medicine ever since. And I really like the medicine side of things. And so that kind of progressed to PA school, despite the fact that I never thought I would really go to college for any length of time, because my first semester was just terrible. And I was like, there's no way I'm going to do this. And I've been in school for 10 years. So, all right.
I'm Nathan. I'm an alcoholic.
Oh my
Hi, Nathan.
Here, scoot the mic closer
Oh,
to your
yeah.
face.
Well, yeah, I've been in emergency medicine now for, dude, it hit 9 years in September.
Has it been that long?
Yeah.
Dang. Okay.
So I'm about to just make everything just depressing. So the reason why I joined medicine was actually for the emotional side of things. Some people call it psych. I don't like that word. So I call it emotional emergencies, that kind of stuff. So I'm 27 right now. So I have 5 suicide attempts under my belt. 3 of them I should have succeeded.
Wow.
And then whenever those happened, the responders, I used to live in Apache Junction, they just treated me like crap.
Really, it wasn't me.
I don't think it was you.
I used to work.
No, I know. But yeah, no. And whenever I went to college and we talked about those emotional stuffs, I sat there and I asked my instructor if I could play a patient. And then I sat there and I played the whole thing. I was bawling my eyes out. I wanted to show them what it was like. And then I've just gotten so many questions after that of, about bipolar, depression, attempts, why, addiction, because I used to be an opiate addict. And then I was an alcoholic. So the reason why I joined medicine was for that emotional side of things. So whenever someone's at the end of the rope or they feel like they are, I want to at least try my best to tell them hey, it can get better. It's hard. But, if that person called 911 because they want to end their lives, that means deep down they don't, because they dialed 911.
Yeah.
They still are looking for hope. You know what I mean? So, that's why I joined medicine.
Very cool.
That's amazing.
Yeah.
All right, Adam.
My name is Adam. I am a emergency room physician today. Board certified, can't do anything else ever. Yeah. So I started in emergency medicine. I don't know how to put the years together. 21 years ago this year, I was a junior college dropout with a 1.6 GPA. Got thrown out of my house and was looking to open a martial arts school. All I was really good at was fighting.
That's pretty cool.
Well, yeah, there were some pros and cons to that. Most of it was
Yeah.
professional, luckily, but not all of it.
Yeah.
There was a lot of drinking and partying involved, and I didn't know what I wanted to do with myself. So I thought I'll teach and train people and stay fit, and maybe that'll become a career. I don't know how it's going to pay the bills, but I don't really know what to do with myself otherwise. And I had done a couple of odd jobs other than that, mostly in the fitness industry. Ran a GNC for 3 years and whatnot. And I was living in Florida at the time. I had just turned 20. I was coming up on 21 years old, and I was really looking for a way to train more days a week than work. And somebody I met was on the fire department. They said, I work 24 48s. And I went, so I could work 24 and train 48. That I'm interested in. And I'll be outside for the most part. Okay. In Florida, near the beach. And so I said, how'd you get into that? And they said, well, I was in a pretty big city. They said the city fire department here is kind of hard to get into, especially if you're just about to turn 21. You don't have any connections. Nobody in your family does this. It's a pretty tight-knit group. You'd have to really bust your butt. And I said, well, where do I start? And they said, well, go get your EMT. I didn't even know what that was, obviously. And so I went to a condensed EMT program and then went into the fire academy and busted my butt. And I was not an idiot, obviously, book-wise. I just failed out of college because I didn't want to be there for 6 months when I first got tossed out of the house and was like, well, I don't know what to do with myself. Maybe I'll just maybe I'll go to college. And I had no clue what to do with it, so I just didn't go. And that bought me a 1.6 for just withdrawals and DNS for not going.
Yeah.
So I thought, I don't need college. I'll never go to college. EMT is not exactly college. I don't need a degree, just a certificate, so I'll do that. At fire department, same thing. 6, 9 months, whatever it was on the fire academy, is not going to college, so I'll do that. So I did really well in both, busted my butt physically to pass the tests, and got hired on right after I turned 21 years old out of a very small group of people that got hired to this big department. And I despised the fire department. I was surrounded by a bunch of alpha males. I'll leave it at that. I like a lot of them today. I work well with a lot of them. I enjoy their company.
That doesn't sound right. A lot of alpha males in the fire department.
Yeah, it was not my cup of tea. Let's just leave it at that.
Right.
I got written up a couple times for getting soaked on shift and threatening people, and I didn't fit in real well. But after I was there for only about 3 months, I remember we got a call in the middle of the night, and I was an EMT on the fire truck at the master station in this city. And it was middle of the night, 2 in the morning, pitch black out for a rollover car accident with a bunch of kids that were racing through a gang-filled area of town and flipped a couple of cars over. And I remember being the first one to jump out of the rig in bunker gear and go running over to a car that was upside down. And there was a young lady still strapped in her seatbelt upside down. And the car, the A, B, and C pillars weren't holding it so well. And so everybody's getting stuff together to prop the vehicle up. And I remember thinking, well, there's really no point in waiting. She's stuck upside down. If this thing drops another foot, it's her head. And so I just crawled in through the broken window and got inside there, and the lieutenant's yelling, the car's not propped up yet. There's people trying to get stuff around there. And I thought, no, this is probably what should be done first. And I thought to myself, as ADHD and as scattered and as discombobulated as my mind usually was, it was like the calmest scenario. It was like you have one goal, help one person, do one thing. It just felt very calming and focused for an adrenaline junkie. It was like where you're supposed to be and what you're supposed to do. So I crawled up into this car while they're trying to prop it together and started cutting seatbelts. And I remember her yelling, I can't feel my legs and whatnot. And in retrospect, it was probably all stress and who knows. I mean, she's still seatbelted, so I'm sure she was probably fine. But in my mind, I was like, what is really happening here? And amongst all the total chaos, I thought, this is awesome. You might actually help somebody or you might die in the process. And it's all worth it. I don't know. I just found it the most thrilling thing in the world. And I didn't really care which way it went. I just wanted to be helpful in some way. So that was it. I was hooked on the medicine side of it, especially EMS. Unfortunately, about a year later, I wrecked a motorcycle real good back in my young rowdy days. And I was on light duty for 6 months. And they threatened to have me repeat a few months of my probationary year at the fire department. I said, you can have it. And so I walked out and I thought, how do I make a career in medicine without going to college? And that led to another 4 or 5 years of wandering, trying to avoid college. And once I grew up at about 25 or 26 years old, I realized I'd never get anywhere in medicine at all, whether it was in the street or in a hospital or whatnot, if I didn't go to college. And right around that time, I started rooming patients and taking vital signs for a buddy of mine that was an internal medicine doctor who used to work in rural ERs. And after about 6 months of doing that, I wasn't making enough to pay the bills really. And he was like, why are you here? You reiterate everything I talked to you about in medicine, like a textbook, you're obviously intelligent. What are you doing? And I was like, I'm trying to avoid college. He's like, it's not going to work. So I was like, all right, maybe I'll go be a nurse. I started looking into nursing programs. And then I thought, well, this whole PA thing sounds really cool. So I started looking into PA programs. And one day that doctor sat me down. He knew me really well. We're still good friends to this day, even though he's about 25, 30 years older than me. He is one of my best friends and a mentor to me, still lives out in Florida. He sat me down and he shocked me. He said to me one day, hey, Adam, I hear you're getting ready to pack up and apply to PA school and move out to another city to get away from this rowdy crowd, go to college, get through college and apply to PA school. He said, I just want you to know if you go that whole long road, you're going to be a real asshole of a PA. And I was really taken aback. I thought, I'm a pretty nice guy. I'm not really sure what to make of this. So, we get along really well. So I was just stunned. And I said, well, why would you say that before I start on this whole venture? Am I going to hate being a PA or whatnot? He goes, no, you'll probably love it. The problem with your personality is you'll go through all this schooling, undergrad, PA education, whatnot. You'll come out and you'll have a scope of practice, yay big. And one day you'll have to go to the doctor next door to ask a question who's got a scope of practice just yay big. And it will absolutely infuriate you that you don't know everything yourself. And you'll be bitter about it and you'll take it out on everybody. He's like, you just need to go to med school, period. I'm telling you. And I thought, boy, that's a lot of school, it sounds like. But as soon as I got into college and realized it wasn't high school and you could take what you like, get a degree in what you like, take courses you like for the most part, and then gear it towards getting into med school, I fell in love with being a student and was shocked. So was everybody else that ever knew me. And then
you're like,
went
well, shit, I
downhill
like
from
school.
Yeah, it was kind of surprising. Now I wish I could go back and be a student forever and not work, but I'll never be anywhere but in emergency medicine in some way, shape, or form. I still love talking to and hanging out with the medics and the fire guys. I still love, I ran calls with EMS all through residency just because I liked being around it. I for as many downsides as there are to working as a physician in the emergency department in the American medical system, I'd be bored out of my mind anywhere else. And there's always the hope you're actually going to help someone each day. I love it.
Nice.
Very cool.
Love it.
Yeah.
Yeah.
I picked all of you guys not at random, just so you know. It's
Oh, Lord.
I've worked with all of you,
It's like,
or
it's fine,
I
I'm
know
just
your
young.
stories, and
Right. Yeah.
Thank you.
you guys are the only people that said yes.
That's it right there.
Partially true.
Yeah.
But I know I've worked with all of you guys. I know all of your various work ethic to some degree, and I know what people say about you, and that's how I ended up selecting you guys.
Yeah, right.
So take that for
It's like,
whatever.
these
whatever
guys
it
hate them. Let's
is.
get them on here.
So I'm kind of going to introduce kind of the central theme of this new format that we're doing with another little preamble here. So the central theme of this episode series is stories. Stories are a huge part of our human experience, regardless of your profession. They help us make sense of the world. Each of us is made up of our own experiences and stories. And this is even more notable in the emergency medicine setting that we all work in, because we see things on a daily basis that impact us. We see things that rival even the most dramatic TV depictions of the ER or the ambulance. This causes huge highs and deep lows in our own emotions and can cause us to leave work on top of the world or crushed under its weight. We have all heard the question from the new student, what's the craziest thing you've ever seen? And my typical response, I've gotten it so many times, is you name it, I've seen it, and then I just move on with my life and try not to think about it. Because that's mostly true. And mainly because all the stuff that starts running through my mind when I'm asked that question, I just would prefer to shut out rather than dwell on a lot of those crazy things. Because however you interpret crazy, I mean, we've all, you've got that thing that runs through your mind immediately. And that's not something you're going to tell the new EMT student. So I'm going to refrain from asking you all for your craziest stories, but I do want to hear stories that impacted you, educated you, made you laugh, and that you're just willing to share.
Too easy.
That's my little preamble. And I think we all have stories that come to mind. I'm going to just start with a story that I have that doesn't really have a point other than the fact that it made me invigorated, made me excited about emergency medicine. All of this stuff that anybody hears today is just our opinion only. It does not reflect any agencies we work for, hospitals we work for, any companies we work for. It's just our opinions only. Like I said earlier, we've modified all these patient stories so that any resemblance to a real life patient is just coincidental. This is for educational and entertainment purposes only. There is no medical advice here, so do not use this as medical advice. Do not use this to diagnose any medical or healthcare related conditions. My partner Joey and I, this is when I was working a 48-hour shift. We were headed back to our station after a call. It was just a regular day, driving down the highway. And the fire department that we were working closely with on this 48-hour shift, we were always monitoring their fire channel. And they called us immediately code 3. We knew they were out on an electrical hazard. They were already pulled over to the side of the highway working on some electrical hazard, totally unrelated to medicine. And they're calling for us immediately code 3. And we're like, oh, shit, what's going on here?
Yeah.
And a woman had pulled up with her dad. They were on the way to the hospital. And we're going to call this gentleman 53-year-old James. And James was having chest pain. So she was taking him to the hospital. and he went into cardiac arrest while they were at the stoplight right across from the fire department working on an electrical hazard.
Could have picked a worse spot.
And we happened to be very, very close because we were headed back from a call in their area. And so we got there within probably 30 seconds. You know, talk about being in the right place at the right time when seconds actually count, which is not on every call. You know, we all know that, but sometimes they actually count. And we pulled up, the fire department already has this guy out of the car. We immediately throw him on the stretcher. They're doing chest compressions and we get him loaded up immediately. And I'm like, oh, I got to intubate this guy. This is a cardiac arrest. I need to get an airway. And I'm like, no. Look at his heart. What's his heart doing first? So we get the pads on the patient and he's in VTAC. Like, we know what to do for this problem. This is something I could fix. So we shocked this guy and, defibrillated this guy out of VTAC. And, the ACLS algorithm says you start chest compressions right after you defibrillate somebody, right? So we're doing chest compressions and this guy pushes us off because we had shocked him back into a normal rhythm. And
dude, that's when you go.
And I know you guys can all relate. We've all seen this stuff, but it's not that common that you can actually do something like that and bring somebody back from the dead. And so that's a call I commonly think of that just makes me feel good because I was in the right place at the right time for whatever reason, and the stars aligned, and we were actually able to save somebody's life without, losing a whole bunch of brain tissue. And, this dude was able to walk out of the hospital. And I'll kind of talk about maybe what I learned from that story later as it relates to some other things. But I was able to go and see him in the ICU a couple days later, and, this guy was going to have a good outcome. Had a couple stents placed in his heart because he was having a huge STEMI, and he actually had a good outcome. But I like that call because it's a very rare situation where we can actually shock someone back from the dead. You would think that maybe happens on a daily basis if you're not in emergency medicine, but it's actually quite rare that we're in the right place at the right time, especially in the field. In the hospital, all the patients are on monitors. And so when somebody goes into cardiac arrest, we're there immediately. But in the field, it's just so hard to get to a scene fast enough to actually do that sometimes. So that's kind of the initial story that I like to tell. What do you guys got? Does anybody want to start with a particular story that they have in mind?
I'd like to say something about that.
Yeah.
We used to have a paramedic here. His name was Dutch, and he said one of the most profound things once. He said, I just loved getting into emergency medicine. He said, and being able to affect a change in somebody in like 5 minutes. Yeah. He said it's abrupt and it's breathtaking, And so I think we've all had those things, and it just kind of makes you step back and go, dang.
Yeah, absolutely.
That was way cool. They're few and far between, but yeah,
for sure.
Dutch said that. And when he said that, I was like, yeah, that's exactly right.
Yeah.
But then after the call, you open the computer. Oh, I have a lot of shit to type.
Yeah, for sure.
Those instant gratification moments have got their pros and cons.
Yeah, for sure.
You made me think of, I don't remember how this ended, but years ago, working a locum shift, meaning covering for a hospital that doesn't have a provider out in the middle of nowheresville, just to help the community out. I had an old guy who was only conscious and responsive during compressions and didn't like them. And I was like, where are we going to go with this? He'd get 4 or 5 solid thumps, enough to perfuse his brain. He'd sit up, stop. And the wife would look stressed out, and you'd stop, and he'd stop. Wow. And he'd be like, we have to start. And you'd start. And he did it like 5 times. I don't think he made it, but I remember thinking, where am I going to go with
this?
Those
are some effective chest compressions.
And he literally perfused his brain enough to say, stop it, and swat, and then was dead in a doornail in between. I thought, I'm not really sure where we're going to go. I've heard calcium overdoses does that.
Similar. Yeah. Talking.
They don't teach you how to handle that in school.
They don't.
Every time you start chest
7 seconds to talk to this guy who's combative and ticked off that we're thumping on his chest, and then I stop, and I'm like, that'll learn you. So, where are we going?
I had a case like that, Adam, a couple of years ago, and we pulled up on scene. The fire guys were pumping on this guy, or had been, and they stopped. And I was like, what are you guys doing? And they're like, well, he's in asystole. And I said, well, get on his chest. And they went, watch this. And
they start pumping.
And about 10 seconds in, he was like, stop, and he looked at the fire guy looked at me and went, watch.
What now?
So he stopped.
There we go.
Out he went. And I was like, oh my gosh.
That's pretty wild.
Yeah,
It's
it was
wild.
nuts.
Yeah, that's
I'm
how you
not
learn
sure I've
real
ever seen
physiology
that.
right
Yeah.
there.
Yeah.
It's wild. It's stressful.
Okay.
Anyway, cool.
So, I mean, I've asked you guys all to kind of think of some stories that impacted you, educated you, or whatever. So, if anybody has a specific story, we can open the floor to that particular person, and we'll listen up.
Yeah, so I was gonna wonder, do you want something funny, sad? Because I got a whole bunch.
All of the
Oh,
above.
we got
we got
plenty of those.
Plenty of those.
Guys, I'm going to jump in here. That's the end of this episode, but we are going to continue this discussion with these same fine folks next week. So I hope you'll tune in. If you guys found this valuable, if you were encouraged by it, uplifted by it, or if it just makes it so you don't feel like you're so alone with the stuff that you have to struggle with every day, I hope you will go over to practicalems.com, join the email list for more encouraging and valuable information. I'll send you emails to let you know when the new content comes out. And of course, if you subscribe on your favorite podcast player, leave a 5-star rating and review. That is super helpful to allow me to do this. I don't make any money off of it, and it does cost money to produce. So the more you can subscribe and participate, the better I am able to continue producing this. Thanks again, guys, for tuning in. I hope you enjoyed the show, and we'll see you next week.